Namaste. Today topic is nosocomial infection, or we can call it as hospital associated infections. Also we can call it as hospital acquired infections. So what is nosocomial infection? Nosocomial infection, also called as HAI, hospital acquired infection. The infection cannot be present at admission, rather it must develop at least 48 hours after admission. These infections can lead to serious problem like sepsis and even death. Okay, so the infection was not present during admissions. Once patient admitted to the hospital, like a time frame is 48 hours. After 48 hours patient had a symptoms of infections. So in that there are four category of hospital acquired infections. What are all the four types? That is, one is very commonly we can see CAUTI. We used to call it as CAUTI, urinary catheter associated urinary tract infections. CAUTI in the sense catheter associated urinary tract infection, and surgical site infection. After the surgery, if the patient develop any infection, we used to call it as surgical site infection. So after insertion of CVC line, if the patient get any infection, we used to call it as catheter associated bloodstream infections. And one more is VAP, ventilator associated infections. Today I am going to explain on CAUTI. Remaining I will take it in a next class. So what are all the indication for catheterization? If a patient critically ill and will require accurate output measurement, then only we should insert a catheter. Otherwise unnecessary we are giving a infection to the patient. In that case definitely you should see the indications for catheterization. Unnecessary, don't insert any catheter to the patients. So these are all the main indication for catheterization. One is if a patient is critically ill and we require accurate output of a patient, then we used to insert a catheter. And if a patient had urinary retention or obstruction, okay, in that case also we will insert a catheter. If a patient immobilization, he can't able to walk during that time, or if a patient had trauma or surgery, we will insert a catheter. Incontinent with open scar or perineal wound, for that patient also we should insert a catheter. End of life and chronic or existing catheter use. So good catheter care, definitely when we insert a catheter we should select a proper size of catheter. While inserting a catheter, use maximum aseptic precaution. Appropriate drainage system, closed drainage system should be there. Back position, always it should be in a below the waist. Correct advice to patient regarding hygiene and emptying of a emptying of a urine and fluid intake. Plan for, always you should plan for removal or regular changing of a catheter, and deal with catheter problem. If a patient is having any catheter issues, immediately it has to be addressed. Okay, so always you should make a plan for removal. If a keeping of a catheter for a long time, again it will lead a catheter associated urinary tract infection. So always we have to monitor whether patient required for a catheter or can be able to remove, and we can make a ambulating and will trial for some other methods. Okay, so in that way we should. And always avoid urinary catheter use if not indicated. So if it is not indicated, please don't put a catheter to the patient, and try to discontinue the catheter promptly when not needed. So if patient is not needed, immediately it has to be removed. The longer the catheter is present, the higher the risk of infection. So if a patient we are keeping longer time, there is a higher risk of catheter infections. and urinary drainage system should always remain in a closed system. So the catheter system should be in a closed system, so that definitely we can prevent a catheter associated urinary tract infections. So these are all the precautions we should take when patient is on a catheter. So make sure the urinary catheter unnecessarily we should not put to the patient. Here you can see the care bundle of catheter. So what is care bundle? When we insert a catheter to the patient, what are all the check? See, on a daily basis, the nursing staff should check up daily basis of a catheter, so that patient will not get any catheter associated infections. So prefer technique for urinary catheter insertion. So what is the technique they supposed to use? In the sense, perform hand hygiene prior and after insertion. So it is very important again to prevent contamination or cross infections. Hand hygiene is must before and after the insertion. Adherence to aseptic technique. While insertion time, maximum sterility by using of a glove, sterile drapes and sterile sets, sterile swab and betadine usage, and even perineal urethral cleaning is very important again to prevent catheter associated infections. Maximum we should use a closed drainage system. Again it is one criteria to prevent a urinary catheter infections. And proper choosing of a size of catheter. So we should not use bigger or smaller size. So we should see the patient, as per the patient we should choose the proper size of catheter. So once catheter inserted, the daily nurse has to maintain a maintenance care bundle. Okay, so what is the maintenance care bundle? So here you can see always the staff use aseptic technique for daily care. So what is aseptic care? And washing daily basis, and the site has to be kept clean. And don't break the closed drainage system. Urine specimen, if you want to collect any urine specimen from the catheter, always you have to clamp the catheter and aspirate from the syringe. Okay, it has to be done in a aseptic manner. At any cost, don't disconnect the catheter. Okay, so you should aspirate the urine sample from the catheter head with a new syringe, and secure the catheter with a tape to prevent movement and urethral traction. So always the catheter should be fixed on the thigh. Okay, so that it will not get any movements and urethral traction. And keep the urobag above the floor but below bladder level, again to prevent contamination. It is very important. Always the bag should be below the waist and above the floor. Use standard precautions for manipulation of catheter or collection system. So whenever you are going to manipulate or collecting a this thing urine, maximum hand hygiene has to be done, and use personal protective equipments. And whenever you are emptying the urine, maximum you should take your protective precautions like using of personal protective equipments. And the urine should be emptied, and always keep one separate container for each patient, again to prevent contamination. And after emptying of a urine, seal the bag properly, and remove the gloves, do the hand washing. Okay, so every day you need to review for the need of catheter on daily basis. Remove it promptly when no longer required. Okay, if patient become improved, then immediately inform to the doctor. So if possible, try to remove the catheter as early as possible. In that way, again we can prevent a catheter associated urinary tract infections. If you follow this care bundle, definitely we can reduce the incidence of catheter associated urinary tract infections. So the staff nurse who is taking care of the patients, always they should check the catheter care bundle. Whatever it is given instruction, it has to be followed, so that we can reduce the catheter associated urinary tract infection incidents. So this is one of the common nosocomial infections we can see in a hospital. So maximum patients will be on catheter. Okay, in that case it is very important to follow the care bundle. If you follow the care bundle properly, definitely we can prevent CAUTA incident.